A family history of lung cancer can significantly impact an individual's health risks. Recognizing this link is essential for proactive health monitoring and early detection.
Lung cancer is a very important topic. Basically, it is a leading cause of death in the world. And day by day, we are seeing patients of lung cancer, they are increasing day by day. I must tell you the most important cause of lung cancer is smoking. About 80 to 90% of the lung cancer do occur in smokers, and about there are 15 to 30% chance of increased lung cancer in those patients who smokes. When we talk about the family history, if in the family, if the father, brother, or sister has lung cancer, the chances of developing lung cancer in an individual increases. It increases by about 25% more. The reason for the increase is basically if somebody is smoker in the family, the other also tend to smoke. And one common factor is smoking more in the family do increases the chances of lung cancer. Second important cause is there is a radioactive gas which is known as radon. And radon is a gas which is a radioactive substance. It is present in the dust, in the rocks, and in the water. And it gets inside the house through the crevices or cracks in the house. And if the family is staying in an environment or a place where there is increased radon in the environment, then chances of lung cancer in the family do increases. Third important cause for lung cancer in the family is because of genetic mutation. There are certain genes which are present and which if they increases in the family, like what we call as EGFR, epithelial growth factor receptor, and ALK receptors, which are present in the blood or in the tissue, they increases the chance of developing lung cancer in the family. And the fourth important cause, which I must insist upon, is the passive smoking. If somebody is smoker in the family, the other person in the family also has the chance of developing lung cancer because of second hand or passive smoking. They themselves are not smoker, but they are exposed to the cigarette smoke. And that's how the chance of lung cancer increases in the family.
By understanding inherited factors and genetic mutations, you can take informed steps toward better prevention, early detection, and improved outcomes.
The genetic factor, they are about 1 in 4 person who is likely to develop 25% chances of developing lung cancer in the family because of genetic factor. If a person has developed lung cancer in the family, there are about 25% chance that the other person of the family may develop lung cancer. And as I told you, there are certain genetic mutations which happen in the body. And these genetic mutations predisposes the person for the lung cancer, like epithelial growth factor receptor mutation, EGFR mutation, and the ALK mutation, which is present in the genes. And this mutation predisposes a person for the development of lung cancer. And those patients who has got the family history, they are likely to develop a different type of lung cancer, that is adenocarcinoma type of lung cancer is more common when there is a family history of lung cancer.
Lung cancer treatment has advanced significantly in recent years, transforming survival rates and patient outcomes.
I must tell you, few years back, lung cancer used to be considered a very dismal disease with very less survivor. But a lot of advances has taken place, especially in the lung cancer. And lung cancer, we have found a lot of molecular markers. We have found a lot of molecular markers, and the targeted therapies has come in the management of lung cancer. Like I must enlist few of them. As I told you, EGFR is one of the marker. ALK is another very important marker, where the survivor used to be few months, 2, 3, 4 months. With the advent of newer targeted therapies, The people are now living even in stage 4 diseases for more than 5 years or 6 years.